What if I told you that there was a stimulant medication that, on average, had less harsh side effects, a softer onset and offset, an extremely low potential for abuse, and could last up to 12 hours? In this video, I'm going to tell you about Vyvanse and dive deep into what it is, how it works, as well as what the benefits and the side effects are. Coming up. Now, before we get started, I want to know, do you or someone you know have any experience with Vyvanse? Let me know in the comments section below what your experience was. Vyvanse is the third ADHD medication that I've tried, and it's what I'm currently taking. So far, it's helped, but there are some areas where it's lacking, such as helping me with my motivation and my task initiation. And although I do get 12 hours out of it, my days run a little bit longer than that, so I could use something that lasts longer. Believe it or not, there actually is a brand new amphetamine-based medication that supposedly lasts up to 16 hours. It's called Mydeas, which I'll be covering that in a separate video. But back to Vyvanse. Vyvanse is classified as a central nervous system stimulant, or a CNS stimulant, meaning it has effects on cognitive functions, such as regulating alertness, attention, and focus, as well as effects on the cardiovascular system, such as increasing heart rate and blood pressure. Like most CNS stimulants, it's classified as a Schedule II substance, meaning there are more controls over how it's prescribed. One of which is it can only be prescribed in 30-day supplies, meaning that you'll have to get a new prescription every single time that you need a refill. Vyvanse is an FDA-approved medication for the treatment of ADHD in both children and adults, as well as being the first FDA-approved treatment for binge eating disorder. Incidentally, binge eating disorder is actually very common amongst the ADHD population. As of now, Vyvanse doesn't have a generic version available, as it's still a relatively new medication. It's manufactured by Shire, the same manufacturer of the brand name Adderall. It's the fourth most prescribed medication for treating ADHD, and is the 99th most prescribed medication in the US, with somewhere around the neighborhood of 7.5 million users. Vyvanse is a very unique medication in that its potential for abuse is extremely low. It's what's known as a prodrug called lisdexamfetamine. Basically, it's made up of dextroamphetamine with an amino acid attached to it called lysine. The active ingredient, dextroamphetamine, doesn't become active until the lysine molecule is stripped away. This process can only take place during digestion in the gut. The most common way for these stimulants to be abused is to either be crushed and snorted or injected to create an immediate euphoric high. Now, if you try that with Vyvanse, nothing will happen, because the lysine molecule blocks the active ingredient unless, like I mentioned, it's digested in the gut. However, it can still be abused if you take more than what's prescribed to you. But because of its lengthy time release process, the onset doesn't produce a rush, making it kinda lame for a party drug. Vyvanse is a long-acting medication that can last as long as 12 hours, depending on how your body metabolizes medication. There is no immediate release form of Vyvanse, though some doctors will prescribe an immediate release Adderall for a booster in the afternoon, as they are both amphetamine-based medications. But for the majority of people, it's a once-a-day medication, which makes it very convenient. Unlike Adderall, Vyvanse doesn't contain any levoamphetamines, which are generally attributed to a lot of the physical effects felt by the stimulant medications, such as increased heart rate, increased blood pressure, or the amped up jittery feeling that is quite common with Adderall. Although this is no guarantee, as everyone will react differently to these medications. Vyvanse only comes in a capsule form with a powdery substance inside of it. It's specially formulated to release slowly throughout the day. For those that have a hard time swallowing pills, the capsule can be opened and the powder can be dissolved in some water, and it can be taken that way. Because of the special process needed to release the active ingredient in Vyvanse, it does take a little longer to get working in the system. Close to an hour, as opposed to Adderall or Ritalin that generally only takes about a half hour. However, due to this slower onset, most people report that they don't have that jolt that they do with Adderall or Ritalin. It's more of a gentle takeoff rather than being strapped to a rocket. On the other end, Vyvanse is known for tapering off a lot more gently than some of the other stimulants. This helps minimize the crash feeling that a lot of people get with other medications. Vyvanse, like Adderall, works by increasing the dopamine and norepinephrine in the brain. Some of the benefits of taking Vyvanse can include better focus and attention, reduced hyperactivity and impulsivity, better emotional regulation, an increase in motivation and task initiation, more sustained attention and stick-to-itiveness, better task completion, better working memory, an easier onset and offset, reducing the initial jolt when the medication kicks in and minimizing the crash when the medication starts to wear off. Now I know this all sounds great, but keep in mind that everybody responds differently to these medications, and not everyone is going to experience all of these benefits. Mostly what you're looking for is an improvement in some of these areas. There is no cure for ADHD, and these medications should really just be seen as a tool or prosthetic that can help you perform at an improved level than where you were before. Realistically, expect to see some improvement in some of these areas, not a complete turnaround in all of them. Fortunately, if Vyvanse doesn't wind up working for you, or if the side effects prove to be too much, there are other medications to try. The goal with medication is to find the right one in the right dose and with the least amount of side effects. It may take some time to get there, but it's usually time very well spent. Now, what are some of the side effects of Vyvanse? Well, they're really about the same as any of the other stimulant medications. Appetite loss, which is why it's used to treat binge eating disorder, dry mouth, increased heart rate and blood pressure, irritability, jitteriness, nausea, headache, and insomnia are just some of the most common side effects that most people experience. And just like the benefits, not everyone will experience all of these side effects. Usually, you can expect to experience one or two, and in varying degrees. Heck, some people don't have any side effects. Unfortunately, there's just no way to know how you're going to respond to any of these medications until you try them. It's all one big game of guess and check. Just remember, whether you decide to medicate or not, that's a decision that's completely left up to you. Don't ever let yourself be bullied into taking medication if you're not ready to take that step. Likewise, if you think that medication may help you and you want to give it a try, don't let others shame you or talk you out of taking a medication that could potentially change your entire life. Sadly, this usually comes from some of the people that are closest to us, and most of the time, they are severely misinformed. Well-intentioned, but misinformed nonetheless. Make sure to do diligent research on your own. There are several reliable sources for information about Vyvanse and other ADHD medications. Chad.org and AttitudeMag.com, just to name a couple. I'll have links in the description below for these websites. Question of the day: have you ever taken Vyvanse? Let me know what your experience was in the comments section below. And if you like this video, be sure to give it a thumbs up and subscribe for more. Until next time, take care of yourself and be well.